Good afternoon, everybody. This is Dr. Ken Knight at the Paragon Counselor. And today I wanted to talk to you guys about what I feel to be the most important thing in for you to control, for you to understand, not only related to mental health, but the human mind in general. Okay? And the core premise of this video is that every emotion is a chemical reaction, and there's only so many directions they can go, and each direction of those chemical reactions have certain moves that have more reliable, more rapid results than other tactics to address that mood. And if you base the methods and tactics and procedures and protocols of how you address your emotions based off of the chemical structure of those emotions and the evolutionary niche that they served and how that gets corrupted a little bit with modern industrial lifestyles, I think you will experience far more success than if you follow maybe the way that you've been taught socially or academically in some cases, and certainly, as opposed to following the typical pop culture ideas about this stuff, okay? And the first thing I want, if you can accept the idea that every emotional state is a chemical reaction at its base, then the next thing I want you to accept is never mind all of the vocabulary around what your feelings are, okay? It doesn't matter to me whether you call it anger, whether you call it anxiety, whether you call it stress, nervousness, tension, jitters. This is all the same chemical composition and direction in your brain and in your body, okay? And so just to break this down, you only need to understand that there are 4 directions of emotional states that matter on a chemical level, okay? And, I'm going to throw some words on them, but you could argue and you could quibble that, oh, that's not this, I use this word for it. That doesn't matter, okay? What matters is whatever word I'm going to throw on this, I'll also explain chemically after the fact. But when your chemicals are in that profile, they look kind of like this. There's a whole set of techniques that if you do those, the literature shows superior results to just about everything else you could do, okay? And there's also a question of time scale, right? What works well for an hour doesn't necessarily work well for years or for months, and we'll cover some of that too. But I'm just going to call this, think of it like an algebra quadrant, okay, where you've got normal, happy, well, we'll call that, top left. Top right we'll call anxious, agitated, stressed, irritable, angry. Top right, okay. Now, bottom left, we're going to call this depressed, lethargic, sluggish, anhedonic, dysthymic, whatever words you like, that kind of indicate a depressive state, a slowed state, then, that fits that category. And then we got sort of a special category, which we can call sort of elevated, expansive, manic. I'm drawing a blank on more words to describe that same state. Keyed up, high strung. But they've each got different, and when I say high strung, that's, I guess you could also use that for anxiety, but the difference here should be apparent when I get into each quadrant, okay? And before I dive into this, I want you to understand that if you just go about your moment to moment life and you think, all right, what quadrant is my emotional state in this very moment? If you can do that, you will be able to very quickly go, okay, I am leaning quadrant A. What are the tactics that are optimized for the alleviation and course correction of quadrant A? And we're going to get into all of that, okay? And to go into deep details on your tactics, that's going to take some time, but I'm just going to do a real high-level picture here, okay? And I'm just getting started with this channel, but one of these days soon I'm going to do some deep dives on very specific skill sets. But the concepts are required before the execution can be useful, okay? So if you think about this, let's go to normal, well, happy. This means that the chemicals that are pleasant to experience are high enough relative to the chemicals that are unpleasant to experience to where you experience a chemical state of satisfaction, happiness, contentment, normalcy, whatever words you prefer. The meaningful chemical interaction across your 30 to 50 trillion cells, or whatever they say that we're up to now, is one of chemical satisfaction. Okay? And that, if you think about it in evolutionary terms, that is used as a reward to get you as a human or you as a squirrel, because they have the same chemicals basically, to optimize their survival and reproductive fitness. And, when you are acting in accordance with your optimized capability and you perceive that to be the case, then this is where you're going to live most of the time for most people. And just by virtue of saying this, you might already be forming some ideas in your head about what's, if I feel like this, why, and what do I do about it? Some of this stuff will become very obvious once I've explained the mechanism of the problem. Okay. And let me just also say that I'm not discounting, genetic disorders, physical trauma, severe events, extreme social conditions such as poverty or pollution, or regular exposure to violence, right? But for the vast majority of people in the vast majority of normal situations that we would consider who have the time to watch a YouTube video, okay, then we're going to kind of assume that this will hold true, and you can even run micro experiments on this concept, and you could track your results. Okay, so quadrant one, don't do anything different. If you're happy, if you're good, make sure that you're not doing so at the expense of your long-term success. But if your normal approach leaves you feeling normal, happy, satisfied, content, don't mess with the recipe, right? So let's move over one to, and we're going to call this anxiety, anger, agitation, whatever words you like. But on a chemical level, this means that chemicals that are unpleasant to experience, we might also call them stress chemicals. These are high relative to your reward chemicals. I hesitate to say good and bad chemicals because they all serve their purposes, but these are not enjoyable to sit with for any period of time. Okay, and there's a lot of chemicals at stake here, and I'm not trying to turn this into an organic chemistry lesson, but some of the big ones, you've got acute stress chemicals, you've got adrenaline, norepinephrine, and then you got some of the chronic ones. You've got glutamate, NMDA, cortisol. Some of those are popular, some of those aren't. But the idea here is if you find yourself feeling tense, tight, stressed, agitated, that's a sign that you have more of that stuff in than you probably need. The exception here is if you are in an acute danger situation, or you're in a scenario where if you are not keyed up, a lot could go wrong. In that scenario set, feeling this way is optimal and makes sense to a point. Okay. But if you're just going about your daily non-emergent lifestyle and you feel tight, tense, irritable, anxious, agitated, something needs to change, okay? And there's a whole different set of techniques, tactics, and procedures if you're feeling this way that will work very well, that may not work as well if you're feeling a different way, okay? This quadrant is really important because it can guide your optimal tactics to follow the tracking of your emotional state, all right? So quadrant one, normal, happy, satisfied. Your feel good to feel bad chemicals are where you want them. Quadrant two, anxiety, stress, tension, agitation, anger, irritability, hostility. This is your stress chemicals, your feel bad chemicals are high relative to your feel good chemicals, all right? Now let's go into quadrant three here. And we're going to call this depressive, lethargic, dysthymic, low energy, what have you. The critical point here is that and this should start to sound obvious, right? There's only so many ways chemical levels can move. Your feel-good chemicals are low relative to your feel-bad chemicals. Now, you might ask, well, what's the difference? You just said that the feel bad chemicals are high on the other one. There is a marked difference between an emotional state where your feel good chemicals are kind of normal, but your feel bad chemicals are extremely high. That is anxiety, stress, agitation. Okay. But when your feel good chemicals are low, now there's a lot of these too, but I'll drop a few. We all know dopamine, we all know serotonin. There's anandamide for creativity. There's oxytocin, serotonin, vasopressin. There's some more. But when these are not dialed in and they're dragging and they're low, or you're depleted, or you're living unsustainably, or your pressures are too high, and so you've had to exhaust that supply to deal with the stress of quadrant 2, then you're going to feel tired, hopeless, slumped, depressed, lethargic, anhedonic. Pick whatever words you like on the feelings chart, right? The solution to that, or the solution sets to that problem, are different than the solution set to agitation spectrum emotional states. Okay, and this is why, like, if there's one takeaway from this video when we're done, is that and I'm repeating myself, but you must track how you're feeling specifically so that you know specifically what follow-up tactics to utilize to optimize your recovery. Okay. Now let's get to the last quadrant. This one's a little tricky, but we can call this manic, we can call this edgy, we can call this keyed up, we can call this buzzing. I'm trying to think of more words for this, but this is when both your feel good and your feel bad chemicals are up. Okay, you might, sometimes being in a manic state can be very enjoyable. The problem tends to be in your lifestyle outcomes, and also the agitation to pleasure distribution will very predictably tilt to where the unpleasant sort of strangles out the pleasant and then leaves you in an agitation state and then exhausts you and then leaves you in a depressive state. Okay. And we've kind of described a good number of bipolar disorders that way. So I want to go through each of these, and let me just one more review. Top left, normal, happy, satisfied, feel good, high, feel bad, kind of low. Cool. Quadrant 2, anxiety, tension, agitation, stress, feel bad or higher than the feel good. Okay, not good. Quadrant number 3, depressive, sluggish, lethargic, your feel good chemicals are very low. And this one is probably the most dangerous state for most people because it's harder to take action during, okay? And the techniques are a little bit harder to access to get immediately out of them, okay? And then quadrant 4, which is feel good or high, feel bad or high, manic, manic, buzzing, impulsive, that kind of stuff, okay? So what you should be doing as a human who wants to be in command of how you feel most of the time in most circumstances, you want to identify by observation. Now, observation is hard. I can throw that word at you, but if you don't know how to track your emotional state, watch your somatic cues, listen to the tape of your self-talk. We could drop those skills later, but you're looking at a meditative practice. You're looking at just situational awareness. I can't give you that skill today, but I'll make another video, mental note, But once you've tracked your emotional state, and not just I feel bad, I feel good, I feel lethargic. Feel good chemicals too low. I feel jittery. Feel bad chemicals too high. Okay. When you know where you stand, all right, then you need to employ the tactics that the literature prevailingly states to be really, really powerful at pulling you out of that particular set of problems. Now, I really want to stress the specificity here because tactics that may be excellent for depression could be counterproductive if you are in anxiety, panic, or rage. Okay, a good example here is, if you are very depressed, you might find Tomo meditation, heavy weight training, and these may be very useful to you when you are depressed. But if you employ them when you're anxious, you run the risk of stressing yourself more or bringing yourself closer to undesirable immediate actions following a heightened state of stress. Okay, the tactics matter by the specific category of your emotional direction, So for you to get anywhere, you need to understand the directions of your emotions by their chemical substrates, okay? One more time, I know I'm repetitive, but if you learn nothing else from me, I wish the entire world had this bit of knowledge. Quadrant A, I'm feeling okay. Good's high, bad's low or moderate. I can deal with that. Quadrant 2, my feel bad is too high. I don't like that. I feel tense, angry, jittery, defensive, what have you. Employ a set of tactics that is different than other quadrant tactics. Quadrant 3, feeling kind of tired, kind of slumped, kind of sluggish, kind of hopeless. Nothing feels like it matters. What's the point? When you feel that way, you need to employ specific tactics that go after that problem. Okay. And the final one, this one's tricky because in a manic state, or when you have high bad and low good at the same time, or sorry, high good, high bad at the same time, you probably want to treat this like you would with your quadrant 2 stuff. So your anxiety, agitation, anger, you probably want to go after that problem. But when you're done with that, you may want to to step out of a situation because you actually run into some impulsive risk when you go immediately from quadrant 4 to a quadrant 1, right? You go from I'm agitated but happy and really keyed up and impulsive and excited. If you take away the agitation, you still have the unrestrained euphoria, and that can get you in trouble, especially if your credit card is nearby. So I hope you get the point I'm trying to lay down here, which is identify your emotions in categorical detail and then cultivate skills training that you can plug to deal with that specific set of emotions, okay? And it should be pretty obvious by now, but when you're in quadrant 2 and your agitation state's too high, your tactic should involve reducing the amount of stress chemicals, okay? When you're in quadrant 3 and you are lethargic, sluggish, depressed, your tactic should involve increasing those flow state, happy, reward chemicals. When you're in quadrant 4, you need to reduce the agitation state, observe for euphoria or depressive state, and then get yourself out of a situation where your immediate actions could get you in trouble when you're ultra happy, okay? I hope this was some value to you guys, and I know that there can be some chemical complexity here, and organic chemistry is a complicated subject that I'm no master of. But if you see this from its mechanical reality, I think you will be far more effective at understanding and commanding how you feel. Okay? Thanks for your time and attention, guys. I look forward to the next one.